The FDA has announced the U.S. won't likely receive emergency use authorization to vaccinate children as young as 2 years old until the fall at the earliest. Pfizer, which is currently conducting trials for children ages 2 to 11, says it plans to apply to the FDA to authorize its vaccine in September. In the meantime, Moderna is also conducting clinical trials with small children. And it all comes with some encouraging news on the front lines of the pandemic. For the first time since it began, the number of coronavirus cases is down in all 50 states. Nationwide, new cases are down 87% and deaths are down 82%. So for more on this, let's bring in Dr. Dyan Hes. She's the founder of Gramercy Pediatrics in New York. So I know, doctor, because we've been talking throughout the whole pandemic, you're probably pretty pleased with this news that, vaccines are sort of looking to younger children now, the pharmaceutical companies. Dr. Hes, with case numbers on the decline in several states, and after the recent FDA approval, children 12 and up are starting to be vaccinated. We've talked about how doses for younger Americans are likely to be different, but what can we expect a potential vaccine schedule to look like?
We don't know yet. So we're going to have to see how we're going to incorporate it into the regular vaccine schedule. But my guess is that the children will come for a yearly COVID vaccine, just like you get your yearly flu vaccine, and perhaps a booster or perhaps two. We don't know that yet. It all needs to be TBD because the trials have just started. My guess is that the children will have immunity for longer than the adults because the children have stronger immune systems. So maybe they'll only need one, whereas somebody 65 and older might need that booster. But we have to enroll the kids in the trial and then draw their blood at 3 months, 6 months, 9 months, 1 year, and then even 2 years out and see if their antibodies stay up. But probably we'll start with 2 vaccines just because that's what we've done so far. But I wouldn't be surprised if it went down to 1 a year for children.
So, Doctor, as Pfizer and Moderna conduct vaccine trials in children ages 2 to 11, the Kaiser Family Foundation recently released a survey that reveals 32% of parents are taking the wait-and-see approach when it comes to vaccinating their children. You are an advocate for getting kids vaccinated. Help us understand vaccine hesitancy when it comes to parents and their kids. It's often that parents and adults are okay receiving the vaccine themselves, but are a little more iffy, I guess, when it comes to their kids. Understandably.
So I think a lot of this has to do with the fact that the vaccine is not available in most pediatricians' office. The government has made it almost impossible for a pediatrician to get the COVID vaccine in their office. And I think a lot of trust comes from your doctor. I had a dad there yesterday. I saw his 1-year-old, but he has a 14-year-old. And he said, my 14-year-old is allergic to peanuts. You're her doctor. I don't want to go to a big box pharmacy and get the COVID vaccine there. What if she has an anaphylactic reaction? And I explained that, it's really not going to happen. People with peanut allergies haven't been having more allergic reactions, but that's his fear. Okay. So, but I can't offer it because I need to spend $15,000 on a freezer for the Pfizer vaccine, and I have to order a minimum of 1,000 vaccines at a time. So what one doctor, Dr. Cheryl Wu in New York City, is trying to do is trying to get us all to pool our resources to buy one freezer. Then we will run with a taxi, grab the Pfizer vaccines in a cooler, and bring them back to our office, which is it's just ridiculous that this is a supply chain. And this is New York City, so you can imagine how it is in the rest of the country. Because if I don't use those vaccines in time, they will expire and I will have to throw them out. So I have to know I have a certain number of kids on my schedule to get those vaccines. It's just a mess.
So testing is still an important component of keeping the virus at bay, especially as, we open things up to sort of larger events. And I know that some events people have had to undergo testing or show that they've had the vaccine in order to participate. So the University of Illinois is sort of developing a new COVID-19 saliva test. You're supposed to get results within like 30 minutes, supposed to be very accurate. What can you tell us about these saliva tests?
So these saliva tests, I think, are going to be a game changer because I think these will be implemented all over, not just at, events, but like when you're flying. It's the cost. What they say in the article is that the cost of the test is going to be almost $6 to $7, which is way lower than like the $40 or $30 test that we're getting from Abbott or BD. And they can be done fast, and people will be much more willing to give saliva than to have a swab stuck up into their nasopharynx. And I also think that as the vaccine is more prevalent and there's more just people who've had COVID and weren't actually even tested or just had the rapid test and it didn't get reported. I think we're just seeing a lot of more immunity than we knew that was out there. I think the numbers were way lower than the actual numbers of people who had COVID in the U.S. And I think that these saliva tests will pick up the breakthrough cases. I think it's great.
So about those tests, doctor, one of the things that I think is interesting is that oftentimes, for example, we're trying to plan a vacation and we're trying to, leave the country. And one of the countries that we're trying to go to wants, and I'm going to mangle this medical term, the nasopharyngeal. What is the test that you get?
Pharyngeal.
Thank you. Okay, so I almost had it right. Pharyngeal. Okay.
Yeah.
So that's what they want. They don't want rapid tests. They don't want the saliva tests. So when you say game changer, it's great that you can be tested and it's good to know that you're healthy. But what does that mean if other institutions, countries, public health officials in that they don't accept those test results? Well,
that's why you have to have published literature. So when we show that this new saliva test does work, it's a DNA-based test, so it's very similar to the PCR. So that will have accuracy similar to the PCR, and that's why we need trials done. And then you show another country, you say this saliva test has the same, sensitivity and specificity as a PCR, and things will change, because this is not sustainable to keep on doing nasopharyngeal swabs forever. Things have to change, and the technology is evolving to deal with this pandemic. But until that, does get published and gets approved, there'll be nasopharyngeal swabs.
Right. So even though it seems like we're sort of turning the corner a little bit on this pandemic, the fallout from the pandemic continues, and not just sort of, directly with people who, is that your dog?
Sorry.
In the background. It's like, you have questions, Anne-Marie, I have answers, even though I'm a dog. But
my kids are in school, my husband's at work, my dogs.
The dog should know how Zooms work at this point.
We all understand that. Yeah, but I wanted to ask you about kind of some of the side effects of this pandemic, specifically that, Black, Hispanic, Asian populations have been disproportionately impacted by the indirect effects of the COVID-19 pandemic, including, not going to the doctor to take care of other things. And we're seeing a rise in cardiac deaths in some of these groups as a result. It seems like we're turning the corner. It seems like we're doing well, but there's still an uptick in these kind of side effects of the pandemic. How concerned are you about that? That people, after breaking their routine and maybe going to the doctor for routine checkups, it'll be hard for them to get back on track again.
Yeah, I'm very worried, because remember, many doctors' offices were closed. Then many people were told only to come if it's urgent. All types of preventive health, mammograms were canceled, colonoscopies were canceled, EKGs, all heart disease, they were all canceled because they were not urgent. So we had many people dying at home from heart attacks, stroke, and a lot of people were attributed to COVID. And it wasn't COVID, it was a COVID-related death because you didn't get help. And a lot of these families, especially because Black and Hispanic knew that their populations were being disproportionately affected by COVID, they were even more hesitant to go to the hospital, and they're even more hesitant to go back to the hospital. And we have more vaccine hesitancy in those populations. So we really need to educate people, to get them to go get their vaccines, and then to go back for routine health care. I had a mom just cancel her son's allergy appointment this week because she's still scared to go into a doctor's office, and she is vaccinated. And I explained to her that the risk of her son catching COVID is so low in an allergist's office, but the risk of him exposed to a food allergen and dying without an EpiPen or correct care is much higher. But it's very hard to tell people, to reassure them to go back into the doctor's office. And we have to do that with our elderly community, with our minority communities. We need a lot of outreach.
Dr. Dyan Hes, thank you so much.